and ultrasound training scenarios. If you're just joining us, welcome. At this point, I'll introduce SonoSim founder and CEO, Dr. Eric Savitsky, who will be discussing how to integrate ultrasound findings into medical decision-making and will highlight some exciting new advances that enable real-time dynamic control of ultrasound training scenarios. Welcome, Dr. Savitsky.
Great, thanks for the invite and very excited to be here with everyone today. Just to talk a little bit about our latest advances at SonoSim. So we've been receiving a lot of feedback over the last several years in terms of how we can improve SonoSim LiveScan and Case Builder to really achieve its ultimate aim and ultimate goal, which is really helping instructors and learners once they've acquired the ability to obtain an image and interpret an ultrasound image, how do you actually make a clinical decision with that? So the purpose of SonoSim LiveScan with Case Builder has always been to teach people how to integrate ultrasound findings into medical decision making. And what we're going to do today is really discuss some of the advances that we've made that will really help facilitate that process. Once again, just to bring it back to a high level, and then we'll get into the specific improvements, innovations, and features and how to apply them, is just stepping back and really thinking about where this fits in ultimately what we're trying to teach and impart on our learners, which is ultrasound competency. And as we all appreciate, there's many different elements that lead to ultrasound competency across different applications, which include the indications for an ultrasound exam, the applied knowledge of ultrasound equipment, the ability to optimize an image, how to perform a systematic examination, how to interpret the acquired images, how to document that. And then what we're going to be focusing on today is medical decision making. So how do we use some tools to really improve that process? And once again, in terms of where this fits into our SonoSim ecosystem, so SonoSim provides an ecosystem of a variety of different tools and applications that really help. If you think of the prior slide and all the different elements that lead to ultrasound competency of the ecosystem, SonoSim provides us online didactic courses, the Sonos simulator, which allows you to learn how to acquire, interpret images and have access to real pathology using a personal laptop, having the ability to practice ultrasound guided procedures and develop a really good understanding of the visuospatial and visuomotor skills required to perform ultrasound guided procedures. And then here, what we're going to be talking about today is how do you actually integrate ultrasound findings into medical decision making, and also some additional case-based learning in the form of question bank, which is a really exciting innovation that we'll touch on today. We have our SonoSim mobile app, which accompanies the learner. And once again, super, super important to appreciate that what SonoSim does is it creates an ecosystem around clinical practice. So central to learning ultrasound and fully irreplaceable is the need to have a real ultrasound machine, have a patient, and practice what you've learned, identify what you know, identify what you don't know, sometimes use the mobile app for just-in-time refresher training or to prep before performing an exam, doing the clinical practice, and hopefully learning from that process, and then coming back and either acquiring additional knowledge, scanning skills, procedure skills, or understanding how to actually integrate your findings into medical decision-making. And then ultimately, the final element of the ecosystem is tracking performance, documenting mastery, and as the standards and guidelines evolve in ultrasound, this becomes more and more important. Learners need an e-portfolio, and there's an exciting feature that we'll be discussing in subsequent webinars, which is our automated image review powered by AI, and we'll briefly touch on that today. So the focus of what we're really going to be discussing today is just some new features that are rolling out. Some exist in our current release, and others will be coming out very shortly in the second half of this year. So some of the existing advances, this is our new interface for our CaseController. So what CaseController is through any web-enabled connection, whether you have an iPad or a mobile phone, you're going to be able to connect to SonoSim LiveScan and be able to control it using, once again, whatever web-connected device you use. Here we're using an example of a mobile phone. And from that mobile phone, rather than actually having to be physically at the bedside of a laptop, which can be a little challenging when you're in the middle of a scenario. If you think you're in a simulation center and your ultrasound machine and your PC are basically one, having someone coming in to try to advance a case or advance a feature can become very, very challenging. So by having a web-enabled, web-connected way of controlling your interface, that should make the scenarios much more seamless and much more realistic. So not only is the remote case controller an advance, but if you look here, not just being able to navigate through the interface, but this is a super, super important feature, which we'll talk about in greater detail. It's the ability to change heart rate, respiratory rate in the middle of a scenario. So this is a super powerful tool, which we'll talk about, and the ability to impose pathological states. For instance, a patient could come in with a pneumothorax, and if they receive a chest tube, you can actually substitute the presence of lung sliding where it was absent earlier in a case, and then you could dynamically control the scenario to positively reinforce a correct clinical decision, or you could change the vital signs and have a patient decompensate in response to an incorrect clinical decision. So very, very excited to talk about some of these features. All right, so what we're going to discuss here is, so you've decided that you want to create a SonoSim LiveScan case. You go to SonoSim Case Builder. You can select from one of our pre-created packages. At this point, we have 9. There's a couple that aren't represented in this graphic, or you can create a customized case. So what we're going to show you here is how you go about that. Here, we're going to create a customized case. And the case we're going to create today and talk about is an 18-year-old patient who suffers a gunshot wound to the left upper quadrant, as well as the left lower chest. So here you can actually type in your clinical history. We're going to make this person have a tension hemopneumothorax and be physiologically unstable. So you can type in, this is what a user would see. So a user would go to SimStation 1. So this could be a manikin or a volunteer. They would load the case, and they would subsequently be exposed to that history. And then what you're seeing here is how quickly you can go through, pick the right upper chest window, picks positive lung sliding because this is normal. So that gets populated with normal findings. Here you want a pneumothorax. So you're going to search for pneumothorax. You're going to select pneumothorax, and it's going to get imported into that window. You're going to want normal cardiac findings. So we'll pick normal cardiac function, and the apical, subcostal, proximal IVC view will all be populated with those findings. We'll pick free fluid in the left upper quadrant because the gunshot wound went transdiaphragmatic in our scenario. We're going to view what the patient pathology will be. So that looks good. So we're going to import pathology into the left upper quadrant. We're going to put in pathology in the left upper quadrant, and we're going to select normal for everything else. Once this is done, this gets published. We save this case, and it basically gets published to SimStation 1. So a subsequent user would go to that station in the simulation lab and encounter this case. So what we're going to transition to here is actually our next advance. So here you can see, if you just step back, the user interface is very, very different from what currently exists. So this is feedback that we've received from you in the sense of when you have a learner that uses SonoSim LiveScan in a scenario-based training, when they look at the interface, it has to be an interface they recognize and something that looks like a point-of-care ultrasound machine, which is what we've created. And the other thing you see is the controls. And rather than having the user have to have the probe and then go towards the head of the bed and change the controls, all things that people have to do in real life, but can be disruptive in a scenario-based setting, especially if people don't know how to use SonoSim LiveScan because they've just been brought in as part of an OSCE or a standardized patient experience. You can control very simple things like depth and gain and advanced features using a remote control feature, which we will show you how that works very, very shortly. Here, what we're going to illustrate, in addition to what we talked about, is here it shows that you've put in a web code. And by putting in that web code, you can have any web-enabled device, whether it's a mobile phone in this example, or a laptop computer. And this could be at the patient's bedside, at the foot of the bed, in an entirely different room. You can take active control of that interface, and you can change vital signs, you can advance screens, you can change different elements of the user interface. So super powerful tool that allows you to control things from the foot of the bed, head of the bed, from a different room. And once again, it's web enabled, so there's no real Bluetooth proximity requirements. So very, very excited about this, allowing instructors and administrators to really control and help learners engage in a very realistic scenario. This is the next feature that is super, super important and potentially the most important. Here, it's the ability to watch how a user goes through a case. So in this case, 18-year-old gunshot wound to the left upper chest. Ideally, the user recognizes there's left-sided pneumothorax and free fluid in the left upper quadrant and acts appropriately, which may be give blood or put in a chest tube. And if you see that the learner's doing that, you can normalize the vital signs. You can take the heart rate and decrease it. You can take the respiratory rate and decrease it in response to what the patient does. And mid-year, we're going to have the pathological states where you can take the pneumothorax and show it as resolved. So initially, no lung sliding. Then you can show lung sliding if the learner selects to put in a chest tube as part of the prompt during the scenario. And you can real-time change that, and the real-time changes, as you'll see, will actually affect the ultrasound images, which is pretty amazing. So we'll show you how that works real quickly. So as you activate this, this is what would happen if you scan the left upper quadrant. So the learner recognizes there's free fluid in the left upper quadrant superior to the spleen. Here, when they initially scan in the left upper chest, they see that there's chest wall movement, but no lung sliding. They apply M mode, or you apply M mode because they ask for it, and you see that there's no sliding on the M mode. You look at the initial heart rate, and you can see that it's tachycardic. The learner may say, hey, I want to put in a chest tube and resolve the patient's pneumothorax. So you can see here, in response to putting in the chest tube, you can pull back the heart rate, and you can see that the heart rate normalizes. So initially it was 140. Here it drops down more to about 80. And then here, once again, you can take a pneumothorax that was present and make it absent. So now you can impart a normal lung sliding pattern in the left upper chest. So when they go back after the chest tube insertion and scan again, they can see that the pneumothorax is resolved. So super, super important tools that allow you as an instructor or as an administrator to really tailor in real time how a scenario will play out and the information that the user is provided that is sonographic information. So once again, changing the sonographic heart rate, the sonographic finding of respiratory rate and breathing pattern, and then the ability to once again impart physiological changes, which will be coming in mid-year. So very excited about these features. Another feature that, once again, if you think of the focus of today's discussion, it's how do you actually integrate ultrasound into medical decision-making? And one of the other ways that we can do that that's been highly sought after and asked for is basically just case-based learning and using our question bank format. So our question bank format here, whether it's a still image or a series of images or clips, you're provided a clinical history. So in this case, an 81-year-old presents with pedal edema, has a history of a pacemaker and a mitral clip, undergoes an echo exam, and then you're asked to interpret the findings and say which of the following best describes the echocardiographic findings, and then there'll be a series of choices. You'll get the correct and incorrect feedback, and it'll be narrated to you by subject matter experts. So Question Bank will allow case-based learning, and then will also teach you how do you take clinical findings and actually use them and translate them into medical decision-making. In this case, it's something as simple as looking at the IVC, looking at the respirophasic variation and basically inferring or estimating what the right atrial pressure is. So that's potentially a clinical application. So a nice example of Question Bank. What we're going to show you here is an additional functional improvement. So equally critical to how well your LiveScan experiences go is how do you actually set up your SonoSim tags. And what this means is one of the real critical features are SonoSim LiveScan can be used on a person or an inanimate object like a manikin, and convert those into virtual patients, standardized patients with a variety of pathology. One of the critical pieces is when the product is shipped, it's assuming that all of the internal anatomy has been modeled on, for us, it's through one of our strategic partners. We use SimMan. So we assume that the tags go on SimMan, but they could go on a person with similar body morphology and it'll work fine. But if you put it on a patient that's maybe only 4 feet tall or someone who is just morphologically very different than what we set as our default settings, you're going to need to customize the tags. And you can choose a default feature. So as we play, you can choose a default feature, and that'll set to factory standards. And a majority of the time, those default features work fine. But once again, if the body morphology of your real patient or your mannequin is different, you can customize the tags and the internal anatomy to align with whatever model you're applying to. So here's an example. You initially calibrate the LiveScan probe. Here you can take the SonoSim tags and apply them in any position. Once you apply them in that position, you simply put the probe on that position and you hold the probe in a longitudinal axis and just follow the instructions on the screen. Once you click align, all of the internal anatomy will be customized to either the person or an inanimate object that you put the tags on. So it really, really simplifies the process, and you can apply the tags in correct physiological imaging windows, and there's very explicit instructions on how to do that. You simply put the probe on the tag in long axis, click align, and all the internal anatomy, all the ultrasound findings will be imported into that virtual representation of that model. So it takes what previously was a very, very complex undertaking, really, really simplifies it, and then you can save it based on mannequin 1, mannequin 2, volunteer 1, volunteer 2, so you can actually know and translate the settings in subsequent um, uh, you know, encounters with either that mannequin or person, and the anatomy will be, virtual anatomy will be very correctly registered. So once again, closing out, just to summarize a lot of what we talked about, because we covered a lot of ground. The focus here has been really looking at how do you teach medical decision making once you actually have acquired an ultrasound image. We talked about all the features and advances, everything from literally just a new user interface and a new user experience to even more exciting features beyond that, which is the case controller of how do you actually control an interface and essentially remotely be able to create a dynamic scenario where vital signs change, and then very shortly you can actually change the pathological features of a case. And then the dynamic nature of it is being able to change the scenario midstream based on kind of what a user does, what a user selects as their course of action. Question bank, once again, super excited about this feature once again, because it's another way of doing case-based learning and just letting people learn in a much more focused way, but similarly really teaching how do you take ultrasound findings and integrate them into medical decision making. And then what we just talked about is our tag align feature. I apologize, our tag setup feature, which is an advance that just really will help you just have a much more seamless SonoSim LiveScan with Case Builder experience. And just to take it back out to a 30,000 foot level, what we've been talking about once again is the SonoSim ecosystem that really surrounds and supports bedside clinical practice. We've been talking about one element of the SonoSim ecosystem, which is how to integrate ultrasound into medical decision making. We've highlighted SonoSim LiveScan with Case Builder as well as Question Bank, and then we've gone over the exciting features, innovations, and hopeful tools that really help you have a more seamless experience. So we look forward to getting continued feedback. We thank you for it, and we're very excited to hopefully ensure that you have just more seamless, more engaging, and just more effective future scenario-based training. Thanks so much.